welcome to the Deep Dive. Today, we're jumping into something pretty important in India's healthcare scene. Ayushman Bharat health accounts. ABHA for short. Think of this as like your quick guide to getting your health records sorted digitally, basically in your pocket.
Exactly. We've pulled together the key info on ABHA, what it is, what it does, and how it fits into that bigger picture, the Ayushman Bharat Digital Mission, or ABDM.
Right, the ABDM.
Yeah. The idea is really to cut through the jargon and give you the essentials.
Okay, so let's start there. What is ABHA fundamentally?
Well, put simply, ABHA is a system, a way to link up all your different health records digitally.
Okay.
You get a 14-digit number, unique to you. It acts like a central thread connecting your medical history across different places you get care.
It's like a unique ID just for health stuff?
Pretty much. It's the foundation for your personal digital health file, you could say.
A digital thread, okay. So that connects my doctor visits, lab tests, prescriptions, all that.
That's a good way to think about it, yeah. And it's not just the number. You also get what's called an ABHA address.
An address, like an email?
Sort of, yeah. It looks like a username, maybe your name at ABM or something similar. It's just another handle for you to, access and securely share your records when you need to, digitally.
Okay, so the number is the anchor. The address is for access and sharing. What's the grand plan here? Why build this?
The big vision. It's about creating the core infrastructure, the backbone, for a truly integrated digital health system across India.
Integrated, meaning everything talks to each other.
Ideally, yes. The goal is to digitize healthcare, make it more efficient, and importantly, more accessible for everyone. Think of it like building digital highways for health information to move securely.
Right, secure digital highways. Makes sense. But how does that actually, help me, the listener? What's the practical benefit?
It boils down to making your personal health records easily available, both for you and crucially for the healthcare professionals you see, but only with your permission, always.
Okay, permission is key.
Absolutely. Imagine maybe in an emergency, a doctor could quickly pull up your essential history. That could lead to, faster, better informed decisions.
That could definitely be life-saving. Okay, so how do I get one? Is it complicated? Expensive?
No, not at all. Getting your ABHA is completely free for any individual in India.
Free? Okay.
And it's voluntary. You don't have to get one. But if you want to, you can sign up pretty easily through the official ABDM websites or apps.
Free and voluntary. Good to know.
Here.
All right, let's dig into those benefits you mentioned. What are the real, tangible advantages for me managing my health day to day?
Okay, so the advantages are pretty significant. First off, it just makes accessing and sharing your records way easier. Digitally, of course.
Less paperwork hassle.
Definitely. Forget hunting for that lab report from 6 months ago. You can get digital results, prescriptions, diagnoses sent straight to your linked account from, various providers, doctors, labs, hospitals, even wellness centers that are part of the network.
So all those bits and pieces of my health info, they can actually come together in one place online.
That's the idea. You link your past records, your future ones, reports, scripts, tests, all tied to your ABHA. It really cuts down on needing physical copies for everything.
I can see the appeal. No more lugging massive files to appointments.
Exactly. Especially if you move or see different specialists. And think about lost reports, a common headache, right?
Oh, yeah, definitely.
With ABHA, that risk is much lower. Your records are saved digitally, linked to you, accessible pretty much anytime, anywhere you have internet access. That important test result, it won't just vanish.
That's a big plus. What about the doctors? How does it help them?
Well, when they can see a more complete digital history again, with your explicit consent for that specific visit, they can potentially make more informed choices about your care.
Makes sense.
They get a clearer picture of your background, your conditions, medications, allergies maybe. It could lead to more accurate diagnoses, better treatment plans.
A fuller picture for better care.
Yeah.
And you mentioned portability earlier.
Yes, that's key too. Your records aren't stuck in one hospital's filing cabinet or server. If you switch doctors or move, your linked records can potentially follow you digitally, assuming the new provider is also on the ABDM network, and you give consent.
Okay, the convenience and potential for better care seems strong. But let's address the elephant in the room. Privacy. Linking all my medical data. That sounds, a bit scary to some people. Who sees this stuff?
That's a really valid concern, and it's something the system designers definitely considered. It's crucial to understand this. Linking records to ABHA doesn't mean automatic sharing. Not at all.
Okay. So how does sharing work then?
It works through something called granular consent.
Granular consent. Sounds technical.
It just means you have very fine-grained control, specific control. Every single time a healthcare provider might need to see some of your records, you choose exactly which records you want to share for that specific purpose.
So it's not an all or nothing thing. I can pick and choose.
Precisely. You're not giving some kind of lifetime pass to your entire medical history every time you walk into a clinic. It's consent per instance for specific data.
So I'm the gatekeeper. Only I decide who sees what and when.
Exactly. Only you, the individual, can authorize sharing your records with other doctors or hospitals within the ABDM system, and it only happens after you give explicit consent for that specific interaction.
Explicit consent. So no sneaky sharing behind my back.
No. The design principle is that your digital health records won't be shared without your direct permission. Now, sharing relevant history can help your doctor make better decisions,
Right.
but ultimately what you share and with whom is entirely your call.
That's definitely reassuring. What about the government, though? Is there a plan for them to use this data? That's another worry people might have.
Okay, good question. Based on the official information, any potential future use of this data by the government would happen only under very strict rules.
Strict rules like
Protocols for making the data anonymous and aggregating it, lumping it together so individuals can't be identified. And these protocols, how the data could be used, they're supposed to be defined only after wide consultations with everyone involved, patients, doctors, privacy experts.
So lots of discussion first.
Yes, that's the stated process. And the key point is, after all these rules are set and made public, then anonymous aggregated data might be used for things like public health policy.
Public health, like tracking disease outbreaks or something.
Exactly. Identifying health trends in the population, designing better health programs, things like that. It's about looking at the big picture, the population level, not your personal medical file.
Okay, population level, not individual. That's important.
And critically, until those protocols are fully defined, agreed upon, and put in place, the government will not be using individual health records linked via ABHA. The focus is clearly stated as de-identified data for public health purposes down the line.
Got it. That distinction is really key. Are there any common myths or misunderstandings about ABHA we should clear up?
Yeah, a couple pop up quite often. One big one is thinking that getting an ABHA number automatically signs you up for the Ayushman Bharat health insurance scheme, the Pradhan Mantri Jan Arogya Yojana, or PMJAY.
Because they both have Ayushman Bharat in the name.
Exactly. But they're separate things. ABHA is just the account, the number for linking your records digitally. PMJAY is the actual health insurance program for eligible beneficiaries. You can have an ABHA without being eligible for or enrolled in PMJAY and vice versa.
Okay, so ABHA is the digital locker, PMJAY is the insurance policy. Separate things.
Correct. Another point of confusion sometimes involves existing government health services, like CGHS for central government employees.
Right. Does ABHA replace those?
No, it doesn't. ABHA isn't meant to replace CGHS or its current hospital IT system, the HMIS. It's designed to be an addition, something that can potentially work alongside those existing systems to offer better digital integration.
So an extra layer, not a replacement. Good to clarify. Now, is ABHA only for government hospitals, or can I use it at, say, a private clinic?
Good question. While it's a government initiative, the aim is for it to be used more broadly. Private hospitals and clinics can choose to adopt ABHA and integrate it.
They can choose. So it's not mandatory for them.
No, not currently. It's up to each private healthcare provider to decide if they want to join the ABDM network and use ABHA.
Okay.
So if your private hospital has adopted it, then yes, you can use your ABHA there to link your records. But if they haven't, or maybe if you as a patient prefer not to use it there, they'll likely just use their existing patient record system.
So adoption might vary from place to place in the private sector.
Exactly. It's an ecosystem that's still growing and evolving. Building that widespread interoperability takes time and buy-in from everyone.
Right. Makes sense. Okay, let's try and wrap this up. What are the main things you want listeners to take away about ABHA?
I think the most crucial takeaway is that ABHA is really a foundational piece for building a more connected digital health system in India. It's about empowering you, the individual.
Empowering how?
By giving you a way to have your health records linked digitally, easily accessible, but, and this is key, while keeping you firmly in control of who sees that information through that granular consent process we talked about.
So my records, my control, but in a convenient digital format.
That's the core idea. And looking ahead, the potential is quite large. Making patient histories readily available with consent could seriously improve healthcare quality and access.
Yeah, I can see that.
It could streamline things like getting test results, maybe even booking appointments or other interactions down the road as the system matures.
This has been super helpful, really clarifying what ABHA is all about.
Yeah.
It definitely feels like a big step in how health information is handled.
It really is. It's a significant move towards empowering individuals in their own healthcare journey in this digital era.
So here's something to think about as we finish up. How could having your complete health history, accessible digitally and under your control, actually change how you interact with doctors, hospitals, and manage your health in the future? It's a shift worth considering, both for you personally and for what it might mean for public health overall.